Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. It's a new year, new president, new day. So normally this time of year, we'd be planning for our 20th annual Collaborative Health Fair. Since we can't do that this year, we're excited to share that we're planning a virtual Collaborative Black Health Summit with many of our partners. So please save the dates of Friday, February 25th from 4 p.m. to 8 p.m. and Saturday, February 27th from 9 a.m. to noon. We will have the latest information on COVID, as well as a variety of health and wellness workshops for community. So we look forward to seeing you there. As we wait for a few more people to join, I'd like to introduce myself and tell you a little bit more about the Center for African American Health. My name is Deidre Johnson, and I'm the CEO and Executive Director for the Center. Excited to say that I just had my 5th anniversary leading this team. For those of you who may be unfamiliar with our work, we are a family resource center in Colorado. We've been serving the Denver metro community for more than 20 years with a focus and commitment on improving the health and well-being of our community. So as we move through today's session, please feel free to type your questions in the comment area and we'll address them if time permits. So Colorado is currently in the first phase of the COVID-19 vaccine distribution process. And that news is being met with a mixture of optimism and skepticism in our community. We are all anxious to engage in life's daily activities again and interact with friends and family like we were able to prior to this pandemic. However, many of us have questions about the safety and effectiveness of the COVID-19 vaccines currently available to public. We asked members of the community to submit questions regarding the vaccines so that they could openly address them, excuse me, so that we could address them with a professional who has an expert knowledge of the COVID-19 clinical trials. My guest today joins us from Seattle, Washington. Dr. Stephaun Wallace is the Director of External Relations of both the HIV Vaccine Trials Network and the COVID-19 Prevention Network at the Fred Hutchinson Cancer Research Center. Dr. Wallace leads the network's external relations strategies and efforts globally with a focus on building long-term relationships with key stakeholders. Thank you so much for joining us, Dr. Wallace.
Thank you for having me. I really appreciate the opportunity.
We're excited to have you here today to answer some of the questions members of our community have submitted related to the COVID-19 vaccines. Before we jump into the Q&A, I'd like for you to provide more context about your work in public health and social justice.
Absolutely. So I have been involved in public health now for a bit over 20 years. It doesn't quite feel as long as that all the time. And my work has really involved not just providing direct care to in community spaces and community settings through community-based organizations focused on HIV prevention and treatment services, but also biomedical research, which is obviously what we're here to talk about today. But I've also been involved in community organizing and engagement activities for nearly 30 years. So I'm happy to share more about that information as we continue as well. But as you mentioned, I'm affiliated with the HIV Vaccine Trials Network, as well as the COVID-19 Prevention Network as Director of External Relations. I'm also a clinical assistant professor in global health at the University of Washington. And community engagement is literally my life and my work. It's at the heart of everything that I do, and it's a focus of my networks and my organization's strategies and commitments.
Well, thank you. So let's review some of the questions submitted from individuals in our community. You know, I have to say, despite being the CEO of this organization, had you asked me about, 6 months ago, if I'd be interested in a vaccine, I'd be like, ooh, nobody's running to a vaccine. But, over time, I've done a lot of research and we've been so involved in the response. I'm actually very comfortable with it now. And so I'm excited that we can address some of these questions. So the first, how do I know the vaccine is safe?
That is a really good question. I think before I start talking about the numbers and the trials, I want to sort of talk about the community and the sort of review processes that have been put in place. So the National Medical Association, which is the country's largest physician network of Black physicians, has been intimately involved in reviewing the data from our clinical trials that the FDA has also reviewed, particularly for the vaccines that are currently under emergency use authorization, both the Pfizer and the Moderna vaccines. So in addition to that group, they've created a task force to do that work. Some other groups have done the same. There are lots of community eyes. There are lots of physicians and networks of different groups, Black and Hispanic organizations and other organizations, Native and Indigenous populations that are involved in reviewing this data. But the study data shows us that the vaccines that are under EUA are safe. And that is the reason why we are able to move forward with an emergency use authorization and why we are here today talking about this, as well as the fact that we have 2 vaccines that communities now have the potential of accessing. So in addition to that, one more thing I forgot to mention was the Data Safety Monitoring Board. This is another huge sort of component to this sort of infrastructure that is, the conduct of clinical trials. So this particular board is an external independent board. They have no stake in the success of these trials, and they are reviewing the data from the trials in progress in order to inform whether or not the participant's safety is being compromised. And if it is, they have the ability and responsibility to stop the study. And so these are some of the checks and balances that we have in place, in addition to what we see at the local clinical trials sites. They have institutional review boards, and these boards are also monitoring information and have the ability to recommend certain things regarding the studies and the conduct of them as well. So there's lots of eyes watching this process. There's lots of people involved in overseeing and monitoring the data, and specifically looking at and prioritizing the safety and well-being of not just participants, but also the people who are getting the vaccine under the emergency use authorization. And one of those systems I would be remiss if I didn't mention was a system that is implemented called Be Safe. And so what we know is that, so we need to continue to monitoring people even after they get the vaccine under the emergency use authorization. And so this program allows people to report whether they have any, symptoms, any issues or any concerns, so that information can be tracked and can be provided back out to people so that we continue to be in the know and aware of anything that may happen.
Thank you for that. So one of the things I learned recently was that when getting this vaccine, folks are under observation for about 15 minutes afterwards. Another question we have is, after I get the vaccine, what side effects, if any, should I expect in the first 24 to 48 hours?
Sure, great question. Generally, I think people can expect some degree, mild to moderate pain, in the arm, whichever arm you receive the injection, as well as potentially fatigue, headache, achiness, muscle pain. Those sorts of symptoms are sort of expected.
After taking the vaccine, do I need to change my diet? That's an interesting question.
I think that's a personal choice, whether or not you want to change your diet. I'm not aware of any dietary considerations, with respect to the vaccines. And I think that prevention measures are still very important. Maybe considering for anybody and everyone, whether you decide to take the vaccine or not, would be good to have a good multivitamin to ensure that your body's getting appropriate nutrients, getting sleep. But the main thing that I want to make sure that I convey here is that the vaccine is not a silver bullet to end the pandemic. And it's important that we continue to practice preventive measures, even for people after they receive the vaccine, because there's still much information we don't know yet, including whether or not the vaccines will prevent infection. The trials let us know that, and the results of the trials rather let us know that the vaccines, both Moderna and Pfizer, have huge efficacy or effectiveness at being able to prevent moderate to severe illness, which may result in hospitalizations and deaths. So,
how long after getting the vaccine does it take for immunity to be established?
There's some immunity that is established about 2 weeks after the first dose, about 14 days or so after the first dose. And then higher immunity you'll see after the second dose, also about 2 weeks after.
And so along those lines, it's really important to encourage folks to have both of those, not just have one and then think they're good to go.
Absolutely. Absolutely. Optimal protection is seen after 2 doses. So it's important to go back for your second dose.
Can little kids get the vaccine?
Not at this time. There are trials that are being planned to start soon that are looking at adolescents. So looking forward to seeing those and the results of those trials move forward. We know everyone is anxious to get our kids back into school and resume some degree of normalcy.
Same question for pregnant women.
So based on this sort of ad hoc or external committee that recommends, that's provided recommendations to the CDC, people who are pregnant and part of a recommended group can get the vaccine. The data on pregnant persons in current trials and in animal development and reproductive toxicity studies is limited. And basically what that means is that we generally do studies in animals to inform how we might design studies for pregnant persons. And so though the information we have from those kinds of studies is very limited. So there are trials that are being planned for pregnant persons specifically. And then of course, ongoing monitoring of persons who become pregnant during the current trials is also happening.
Is it safe for people with other diseases such as sickle cell, HIV, hepatitis to get the vaccine?
People with other diseases who have other health conditions are recommended for the vaccine based on the safety data that we do have. People who have underlying health conditions were enrolled into the clinical trials. And what we understand is that people with some of these underlying health conditions, that these underlying health conditions themselves actually place people at greater risk for hospitalizations and potential deaths associated with COVID-19 disease. So the only health condition I think it's sort of a contraindication or to be aware of with respect to vaccination is anaphylaxis, severe anaphylaxis in particular. So a severe allergic reaction. So people who have a history, sort of bordering life-threatening of allergic reactions to things should be mindful of this and to ensure that you notify the vaccine provider if you choose to go that direction and get vaccinated so that they can monitor you for a little bit longer period of time after vaccination.
So for those of us who don't have access to the vaccine right away, and to be honest, I know each state has a plan, but at the moment it does feel kind of chaotic. What should we do to keep ourselves safe?
That is a really good question. Thankfully, we're in a new place, in a new space today, January 21st. The current administration is expected to roll out a national plan to address some of this question as well. So I want to mention that. But in the interim, I think it's really important that we all practice preventive measures, masking, physical distancing, sterilizing and cleaning high touch point areas in your home and in your community where you may reside, and limit visitors inside your home. Ensure you're again taking a good multivitamin, getting some sleep, and being mindful of your mental health during all of this is really, really critical. One thing I will say about the masking is, because I've had this question come up quite a bit, is I think it's really important that people are getting appropriate facial coverings, and simply having a thin t-shirt over your face, over your nose and your mouth may not provide adequate protection. So I know that economics are always a factor, particularly in communities that have less access to resources. But just wanted to put that out there because though it may provide some protection, optimal masking protection, would be important here. So
let's see, a couple of questions that came in. The first one, I work in HIV and in community, and am planning on getting the vaccine next month or in March. I'm curious about if I'm vaccinated, what's my risk of being a carrier, and also the risk of me transmitting the virus to the clients I serve and others. Also, on behalf of a friend whose husband is at risk in his line of work, should she get vaccinated?
Okay. When I hear carrier of the virus, I assume we're still talking about SARS-CoV-2 virus, the virus that causes COVID-19. So if that's accurate, then I would say that that getting the vaccine at this point, we do not, as I mentioned before, know whether or not the vaccine will confer immunity from infection. So we need to continue practicing the preventive measures that are recommended by the CDC, even for people who are vaccinated, until we can get confirmation about whether or not transmission is prevented from this vaccine. And so for persons who are particularly working in healthcare spaces, who are working around older adults or persons who are vulnerable to COVID-19 illness and hospitalization, it's really important that we also, again, practice those protective measures, not just for ourselves, but for the people that we interact with.
That's so true, because so often we think, oh, I've got this vaccine, I can, live life as normal. But as you said before, it sounds like we can still give it to others, but it's prevention to not get it severely and die, that's pretty significant prevention.
It is, and it is. In my work and, in my organization, Deidre, we talk about 3 ways that we know vaccines can work. And I think many times people assume vaccines can only sort of work one way, and that's to prevent the infection, right? But the 3 ways, the first way is actually, again, most common, is to prevent infection. We would call this sort of the gold standard approach. If we could create a vaccine for anything that would prevent the infection or transmission of the virus, that would be the optimal goal. Because then that way you would not just improve health outcomes in communities, but you would ensure that the negative health impacts are small or eliminated. But if you could not prevent infection in the community, or if this was something still yet to be determined, then the next sort of tier would be to prevent disease or severe illness. This is the silver approach. And this is how the trials for COVID-19 have been largely designed. And then the third approach is, if you couldn't prevent infection, if we couldn't prevent people from acquiring disease, then we may be able to at least prevent or delay disease progression. So that's the third approach. We sort of call that the bronze sort of approach. And so, again, the trials were designed largely to determine whether or not the vaccines can prevent moderate to severe illness. And this is, I think, really important when you think about the rates of hospitalizations and deaths that we're seeing in our communities, particularly among communities of color who may experience, underlying health conditions, as well as other sort of structural and environmental factors that increase their risk hospitalizations and deaths as well. So
will there be resources to deal with a severe allergic reaction at community sites? Well, I guess, should there be resources to deal with a severe allergic reaction at community sites and pharmacies, similar to what will be at the provider's office?
So yes, the recommendations that are going out for community vaccination sites is that they have the EpiPens available, and that people administer the EpiPen at sort of the first sign of a potential allergic reaction, and then, contact 911 and ensure the person gets proper medical care in that way.
Okay. How would one access info on safety?
All of the information regarding the vaccines is available on the FDA's website, actually. So this information is public. All of the reports that the FDA reviewed to inform their decisions regarding the emergency use authorizations are available there as well. So you're able to actually see the reports that these committees were reviewing, as well as see the meeting minutes for the meetings in which those reviews took place.
Another question that came in: how many people do you believe need to be vaccinated for our society to go back to normal? And is there a timeline being predicted?
That is a really good question. And I think that there are a few still unknowns left in order for at least me to be able to respond to that question appropriately. And the first is to find out again whether or not to determine or confirm whether these vaccines can prevent infection. Because if they can, then that would change sort of the configuration or the formula to calculate that information. And then of course, if they can't, then, there's other considerations. So we need to figure that out, that information out first, as well as look at whether or not people who may acquire the virus, if they get vaccinated, does that mean that they can't get does that mean that they can't armally transmit it? So there's a few other questions that we still need to answer before we can get to that place.
Okay.
But there are quite a few people who are looking at this.
Can you talk about the Be Safe network mentioned?
Yes, it's basically like a text messaging system. So after you get a vaccine, your cell phone number gets sort of input into a system, and you receive sort of these check-in texts, to sort of ask you, it'll send you a text, click here, you'll fill out a short survey asking you some questions about any symptoms you may be experiencing. And then they'll ask you to follow up with the vaccination site or your healthcare provider if you have any additional questions. And so this is an opportunity for people to provide feedback and information that would be useful as we continue to monitor these vaccines.
So thank you for that. In Colorado Springs, some nursing homes have administered the first vaccinations to their residents, including this person's aunt. How long will it take for the side effects to show, and when will they be available to the general population? So she's probably talking about the different tiers, which varies by state. But how long would it take for side effects to show, especially if you're someone who's already received it and you're currently in a nursing home?
Yeah, I know from the data that we have, we're seeing the side effects or the outcomes happen within 24 to 48 hours generally. So it's not a long time afterwards. And every state right now, has its own strategy for how it's rolling out its phases for who has access to the vaccine. So I would check with your state health department as well as your local county. Your state health department might have delegated some of that responsibility to your county health department as well. So I would say check with both to find out, where you are in the process. I know some states and some jurisdictions have developed these sort of surveys that you can take and input information, and it will tell you sort of where you are in the process. And then it allows you, for some of them, allows you to input your contact information so that they can follow up with you directly to let you know when your group is available to access the vaccine.
Okay. When might the vaccine be available for people younger than 18 years old?
Good question. I think that right now, see, I know one of the vaccines is, yes. So the Pfizer vaccine has been indicated for persons 16 and older. But as I mentioned before, we're looking at implementing clinical trials to look at how the vaccines work in adolescents. So those trials are forthcoming, and we hope to have the data from them as soon as possible.
So right now we've got Moderna and Pfizer. How many other kind of different vaccines are on the pipeline?
Great question. Janssen, which is sort of one of the arms of Johnson & Johnson, has a vaccine that they're looking at, as well as AstraZeneca, in addition to Novavax. So there's some additional vaccines that are definitely in the development pipeline, and I'm looking forward to seeing the outcome of those trials as well.
And I know that it's not possible, but I've heard a couple of providers say that sometimes people will come in and ask, "Oh, I want this vaccine versus that." Can people be? What do you say to that question about which is better, or that ability to choose, which people don't actually have?
Yeah, the self-selection to me is not, I don't know that it's possible at this time. I can say that the Moderna Pfizer vaccines are pretty identical. I mean, they use the same, they work in the same way. They sort of do the same thing, if you will, in order to protect our bodies and to teach our immune systems how to protect our bodies from moderate to severe illness. So I wouldn't say one is better. Honestly, they have very comparable efficacy rates based on the clinical trial data. So,
Okay. And then, when people see the term mRNA, there's that thought or concern, wait a minute, I don't want somebody rewriting my DNA. So can you share really what that is versus what people may think it is?
yeah, we get this question a lot also. So the messenger RNA process is sort of like, we're providing your immune system with instructions on how to recognize and to fight the virus should your body come in contact with it. And so the instructions for this process are basically encoded in this in the messenger RNA, right? And so then it's delivered into your body through the vaccine process, and it does its work for about 24 to 40 hours, and then it sort of goes away. It doesn't have the ability to enter the DNA of our cells. It's only designed to and functions that it enters the cell just enough to be able to do its job and then disappears. So.
Do you have any words of encouragement to share with community members feeling uncertain about the outcomes of this ongoing pandemic?
Repeat that question one more time for me, please.
This question was, do you have any words of encouragement that you would like to share with the community members who are feeling uncertain about the outcomes of this ongoing pandemic, which might just speak to how long it's been and how overwhelming it feels? Is there a light at the end of the tunnel?
I honestly believe that there is light. I think that there is light, and I think we need to sort of hold on and sort of maintain. And for many of us, we need to probably do a little bit better regarding our prevention measures. because the cases continue to rise and hospitals are getting near or at capacity, which is a very, very dangerous place for us to be as a country. Our healthcare system is already very fragile, and this is prior to COVID-19. And so introducing this global pandemic into sort of our system, into our environment, complicates lots of things, in addition to the socio and psychological impacts that it's having for many people. The other thing I will say is that there are going to be a few different ways that we need to approach, getting back to some degree of normalcy. And I just want to affirm again that the vaccine is not the magic bullet, that we need to really consider the vaccine as part of a larger strategy of responding to this pandemic, including the prevention measures that are recommended by the CDC, so that we can slow down the cases that continue to rise in our areas, in our communities, as well as get a hold on and reduce the impact of severe illness and hospitalizations and deaths that we're seeing in our communities as well. And in the meantime, to find opportunities as we can to address and to nurture and take care of ourselves in terms of our mental health again, and ensure that we're looking after family members and checking in on people, because this is a difficult time for all of us, and certainly for many of us, this is even more difficult as many of us are experiencing loss of families and loved ones. And for many people, they rely on church services and faith and religious connections, and those connections have been challenged with this pandemic as well. People can't worship in the way that they are likely accustomed to. So finding creative solutions and strategies to respond during this time and to help us navigate this is going to help us to get to the light that is at the end of this tunnel.
Thank you. It's interesting. Both from COVID and non-COVID, my own family, just one side of the family, has lost 5 people in 12 months. And it's like this battering ram. So to remember how to reach out to seniors, even if it's via phone call or, drive by, drop off a meal. This is really one of those moments where it's not just about the individual, but leaning into our communal nature that we've always done. Let's see.
That is a really important point, that communal nature piece. I think in times of tragedy, sometimes some may resort to an individualistic approach to navigating this, but we're not an island amongst ourselves. We're all sort of in this, and how we navigate this collectively, I think, is going to be really important, and ensuring that we're not leaving anybody behind in the process.
Yes. Any positive advice that you would recommend giving to friends and family who are against getting the vaccine due to fears or unsolicited advice from non-medical friends and family? And I think this is a really important one to address. Even early on, I was like, well, what is this? What is it not? And I had a cousin in Philly who he had it, and it took him out in 48 hours. And that was a moment of, oh my goodness. But aside from that type of loss, what do you suggest folks say to friends and family who are really just, no, I'm not getting this done because of Tuskegee and other things?
I think the first thing is to talk to trusted healthcare workers. I think that's the first thing. And for particularly those trusted healthcare workers that rely on the science and the facts, and that are guided by the science and the facts. And certainly communities of color, we have the history that says that we should be skeptical, that we should be cautious about how we approach this. I think many people would overstand that skepticism. And I think that as we approach it, we also need to put it in context. I think the the syphilis experiment conducted by the U.S. Public Health Service at Tuskegee Institute is an opportunity to contextualize what actually happened. You know, in my conversations with people, the narrative around what actually happened isn't always clear, and it's not clear to me that everyone always understands what actually took place. But the idea or the name sort of Tuskegee, and you know, it invokes a certain emotional response for people. So I think talking to trusted healthcare workers and then also digging deeper into finding out what's actually happening. I think that the travesties and the horrific events that occurred in the past are actually an opportunity for us to dig our heels into the science and into the research even more, not just to sort of understand how we might be able to be party to any, you know, biomedical interventions or processes, but how we can inform those processes. How can we better partner with and better connect with the researchers and the scientists and, you know, the medical staff who are conducting research to ensure that they're doing so ethically and that our communities and our needs are being prioritized and considered in the process. This is one of the main reasons why I love the work that I do. And I appreciate it is because I get the opportunity not just to do that as an individual, but I get the opportunity to help bring communities along and ensure that they are centered in the process as well. The other thing I will say is that, you know, with the syphilis experiment, that the men who entered the study did not consent to enter the study. They didn't even know that they were in a research study, so they didn't provide consent. The other thing is that they presented with syphilis. They were not injected with syphilis. You know, they were not given the disease. They presented with syphilis already, but what happened is that they were denied treatment when it became available. So there's an opportunity here because the treatment or the vaccine and the treatments for people who acquire disease are here. And we need to ensure that we do have access to them so that we don't get left behind, as I mentioned before.
Thank you. Here's one I haven't heard. Someone mentioned that the vaccine affects fertility. Is this true? If so, do you have additional information on this?
I've not seen any data to suggest that a vaccine would affect fertility, not just the COVID-19 vaccine, but any vaccine. So I don't have any information on that, actually.
And then you kind of spoke to this, but would you say one company is more credible than the other? I'm assuming they're talking about Pfizer versus Moderna versus the other.
Yeah, I will talk about the process. I think it's important to just again overstate that the process of designing these trials, of implementing these trials, has been largely informed not just by the pharmaceutical companies, but by my network and by our network of community partners. So the pharmaceutical companies did not do this alone. They had communities, they had community experts involved in the process. You know, we developed expert panels representing Black African American communities, Latinx communities, Native and Indigenous communities, and older adult populations. And these are panels made up of scientists and researchers and experts who were not affiliated with the clinical trials that were being conducted. And not only are they experts in conducting clinical care and research in these communities, but they're also members of the communities that I just mentioned. So these panels reviewed all of the protocols for all of the studies and provided detailed reports that outline the significance, the cultural considerations, the ethical considerations, and the community considerations regarding recruitment, and you know how the trials need to be thought about as you know they're being implemented. So that feedback was received from those panels, again these expert external panels, We also had community groups working with us in other ways to help inform the process, from our community partners, Black AIDS Institute, the Treatment Action Group, the National Medical Association, Cobb Institute. Of course, we have also the 4 historically Black medical colleges are intimately involved in this process, not just in terms of reviewing the data, but also as clinical trial sites conducting the research as well. So there are lots of eyes and ears in this process: the National Hispanic Medical Association, the various diverse nursing associations, the Black cardiologists, and lots of groups. So there are lots of people watching this process. And so I can say that community has been involved in these trials in meaningful and important and critical ways. Which further to me supports the importance of thinking about how do we ensure that our communities have access to the vaccines. So if communities were involved in designing and implementing the trials, and diverse communities were enrolled in the trials, we had 10% Black folks involved in Moderna, 20% of the trial participants in Moderna were Hispanic and Latinx. We're not actually accustomed to seeing that degree of diversity in trials. So this is amazing. How do we not just replicate it? How do we improve it, right? And so we have diversity in the trials. We've had diversity and the folks involved in designing and having input in the design and implementation of the trials. So to me, it's like, how do we ensure we're not left behind? How do we ensure that all the Black people and all the Latinx people and all the other people who were involved in helping to move this forward, that their efforts result in something for the communities that they represent, for the communities that are being, devastated by COVID-19.
Thank you. Will the current vaccines be effective against new strains of COVID-19?
This is something that's being studied intensely, actually, by several different groups, including some of my colleagues here in Seattle. So the thinking is at this point that the current vaccines will work against the different strains, but we need to look more and to come up with a definitive response. So I'm happy to circle back and provide updates on that as well.
So related to that, do you think this will be like the flu vaccine where every year you get one?
Yeah, we don't know what the durability is at the moment. So I would imagine that this would involve a series that, we may end up seeing this become, a recurring sort of vaccination process until we get the levels of virus in our communities down to a degree that, that becomes no longer necessary, and this is, to me, a credit to, again, how vaccines work and how we've been able to see them work in other disease areas, including polio, smallpox, and then, of course, measles, mumps, and rubella. For smallpox and polio, we saw those particular diseases completely eradicated in our country. Like, no one's walking around thinking about, oh, I might get polio or I might get smallpox. We don't even think about that because vaccines have worked to suppress the virus in our communities. And so to the degree that they're no longer even a consideration. And with measles, mumps, and rubella, we saw the rates of those diseases drop significantly. And, of course, over the last 5 years or so, we've seen some blips, where communities have scaled back on their vaccination, for various reasons. And so we saw some blips in the radar, if you will, where those viruses have been seen again in larger numbers than expected. But in general, what we know is that, when you vaccinate enough people in the community, and we know that the vaccines prevent infection, we can drive out the disease. So that is the ultimate goal for this as well.
Another question. There was a doctor in Florida who died in 2 weeks of being vaccinated for COVID-19. What might be some informed responses to give folks to lower concerns about getting the vaccine?
I think that that's a really good question. I don't have access to this person's medical record. to provide context around, this particular situation. But what I will say is that it's not clear to me and to others that the vaccine was related to this person's death. We've not, with this fact, the vaccines have been given to hundreds of thousands of people at this point. Even just in the clinical trials from Moderna, we're talking about more than 60,000 doses of vaccine. In the Pfizer trial, also more than 60,000 doses of the vaccine. If you think about 30,000 plus trial participants and 2 doses each, right? So we're talking about lots of people being vaccinated here, and we've not seen a single death associated with the vaccine. So I think that that's an important consideration to mention. And as I mentioned before, as we continue to get people vaccinated, we'll continue to monitor this. And if anything changes, then, of course, that information will be shared.
Another question, do you feel that teas and supplements aid in prevention?
Teas and supplements aid in prevention in terms of the virus or the disease?
That was the question, so I assume so.
So I think that anything that we can do to support our immune health is going to ultimately work to our benefit. And I can't say that it prevents the virus because I've not looked at that. But what I can say, as I mentioned, anything that we can be doing at this point to improve our immune system's functioning is going to be advantageous for us. And that's not just a COVID-19 response, that's in general. Because there are other things out here that are impacting people as well. The flu is still pervasive in many communities. And contrary to popular belief, the flu actually does result in deaths of a substantial number of people per year. So the health and wellness of our communities is important. And even from a holistic perspective, that should be considered.
Yeah, it was shared with me recently that among kids, Black children die in Metro Denver 4 times the rate from flu than other kids. Let's see. Is there any advice you can give to those suffering from increased mental illness due to the isolation from things being closed and not having the ability to be part of the community the way it used to be?
If you have access to social service resources, please utilize them. I know many providers are taking their therapeutic and therapy sessions online. If you have access to social service resources that can refer you to a therapist. I know that some jurisdictions have sort of, directory systems where you can call like 211 to be connected to a therapist or a counselor. Particularly if it's a crisis situation, but also utilize other networks. If you're a person of faith and you have connections with faith institutions and faith leaders that you trust, I would say engage those and utilize other strategies as well. Whatever your social interests are, if there's an opportunity to engage in those in a way that's safe, in a way that doesn't put you at increased risk for acquiring the virus or passing it on unknowingly, I think it's important to consider those as well. And talk to a healthcare provider regarding whether pharmacological interventions are a consideration as well.
So with current vaccine shortages and distribution concerns, how protected, and we touched upon it, but this was another question, how protected would a person be if they only got one of the 2 vaccine shots, or they didn't get that second one in that, I think it was 23 or 28 days, but it took, 60 days?
Yeah, so for the part 2 of your question, I'm not entirely sure, actually. I would have to go back and look at some data to get that information. But 1 dose of the vaccine is going to put you at about 40 to 50% effectiveness. So that is, where we are. But I think we should if possible, sort of reframe our thinking around this and really look at the two-dose strategy to ensure that we're hitting above 90% effectiveness for this.
And for the Johnson, the AstraZeneca, and the other one currently in trials, are those going to be two-dose scenarios as well?
Yes, they actually AstraZeneca and Novavax are two-dose. The Janssen vaccine is one dose.
Oh, so for the layperson, why do you think they're one where the other folks are two?
So their initial trial, they decided to do a one-dose strategy based on the data they received from their earlier phase studies. I do know that they are starting a two-dose trial as well to look at how the second dose would boost the efficacy of the vaccine. So they are considering a two-dose as well. And that trial, I think, if it hasn't started enrolling already, it should be enrolling very shortly.
Okay, so just because someone hears about one dose, don't react like that means it's a solution. They just might be making their way to that first 50%.
Yeah, I would say don't react as it's a solution. And then also, these are still in clinical trials. And to my knowledge, they've not been presented to the FDA for an emergency use authorization review yet. So until we see that, there's not a whole lot that we can sort of react to in terms of implementation.
So we are close to time. Dr. Wallace, are there any website resources you'd like to share?
Sure. I don't remember if our colleague is sharing those or how that works, but persons who are interested in learning more about the clinical trials, the science behind the clinical trials, and information about how communities are meaningfully engaged in the process can go to preventcovid.org, www.preventcovid.org. You can also access us and chat with us, engage us on Twitter, Instagram, and Facebook at our, if you just search COVID-19 Prevention Network, it should come up there as well.
Thank you. And those are being shared in the chat now with folks. So I want to thank you so much for today. I feel like this is an ongoing process, but the more and more we talk about it, the more folks will understand what the options are. And really it feels history making that this is a scenario where every day the medical field and everyone is just learning new details of what's possible. But if we can keep people safe and healthy and reduce these death rates, anything we can do to contribute. I'm also excited because, and I don't know if we finalized it, but I'm looking forward to seeing you at our Black Health Summit in late February to kind of continue this discussion. Thank you so much for not only what you do every day, but what you've done historically in this field.
Yeah, thank you. I appreciate the opportunity. Absolutely looking forward to working with you and connecting with you again toward the end of February. And appreciate, again, the opportunity to come and chat with you and the audience about this important topic. I guess if I had a final thought, it would simply be that we have an opportunity to define our future. And it's important that we do consider our past. It's important we consider the hills that we've climbed, the obstacles that we've overcome. And it's equally important, I think, that we really look at how we can define our future and move through this present in a way that supports Black health and wellness and ensures that we are positioned well to access medical systems and interventions as they become available. For so long we had been not included, and it feels like there's change happening. There's an opportunity here. New administration. There's some new things happening. So how do we work together while also holding people accountable? Because that That doesn't go away.
Well, if anything, we have to lean in to make sure.
That part.
Well, thank you. We're out of time. Thank you so much for joining me today, Dr. Wallace.
Thank you.
This video will be available along with other information on the center's website at caahealth.org. And remember to tune in for our Black Health Summit, February 26th and 27th. Thanks again for joining us, and be well, stay safe.